All right, I'm recording.
Yes, ma'am. So first of all, I'd like to share my experience about the exam. So you all know that what on 8th February, what actually came. So the fact is the exam started on 5th February and my exam was on 8th February in the first shift, like at 7:30 a.m., 7:15 a.m. So the fact is there was some kind of definitely fear because only four of us among the 16, only the four among the 12, only the four of us were the IMG and all other were from UK. So definitely there was some kind of fear and everything. And to be honest, from the anatomy, I had I have already shared the, like, I'm forwarding it first in the group, the stations that I have shared. So if you can just take the group. So my first station was the 17th station. That was the OT listing procedure one. So first of all, I'm just first sharing my exam, my what I have actually done during my exam. So the OT listing one, first of all, I would like to tell. So what we practice in day-to-day life, the OT listing we have in our traditional notes, it was among them. To be honest, it was among them. And to be very honest, many of us actually did things like in that order, or opinion differed from each other after the exam we discussed. But I thought whatever I thought right, I just expressed my feelings about the OT listing. And all the questions are from the traditional notes, and all you have to do just practice and practice. First of all, the OT listing, then came the first anatomy one that was about the esophagus, carinal, left carotid artery identification, something like, and all the pictures were much easier from the McMeans anatomy. So it was like the magnified version of the McMeans anatomy, what we follow here in day-to-day life. So don't think about that, like going through other things, just focus on what we have in our hand about the traditional notes. You can go through that about the anatomy, definitely. Then comes about the pathology. The two stations are there, the osteomyelitis and CS stomach. So both the stations are similar. The examiners were helpful. And the thing is, people say that if you give right answer or wrong answer, they don't give any hint, like if you're saying it wrong, if you're saying it right. But the fact is, they sometimes, it seemed that they were very much helpful. And all the questions, all the to the point questions are from our traditional notes. All you have to do, you have to just remember that what is the specific answer. To be honest, I also gave some extra answers during the exam. The examiners were saying, okay, I'm coming to that question, let me just ask you that. So he was just laughing. So it was, the examiners were, like, to be honest, very much friendly in the knowledge stations, definitely. So about the osteomyelitis, CS stomach, the traditional question came. And then comes the critical care ones. Post CVP pneumothorax is the commonest station in this February diet. So all the questions are from our traditional notes about the Bound and ARDS. It's the same things we have practiced. They will give you the X-ray and the CRIS protocol, ATLS protocol. How do you manage the patient, the Parkland formula, everything they have asked from the traditional notes. Then comes the pain management. All things are same from the traditional notes. About the examinations, so to be honest, I was very much skeptical and doubtful about my skills part, because after giving the exam, so I was not satisfied with myself after this much practice with ma'am and everything. I thought, like, from my point of view, I thought I could give much better, because these three examinations, the CRIS, pulmonary embolism, hand examination, and spinal wall limb examination. So during our practice day, you always discussed with ma'am that these examinations are very much longer. So how do you do that? So, like, during the practice, we would never like finish it, something like that. But their main thing they want from you, like before the examination, they were discussing like about the skills part. You have to just go in your own moral way, in your own way, the way that is perfect. It's not that like you have to do hurry to finish every station. So they actually said this before the exam. So that was one convincing thing, that okay, I don't need to hurry, I have to just focus on the patient dealing, on the patient satisfaction, because that is the thing the lay examiner will check during this skills part. And the lay examiners are basically from this licensing, that GMC part, because they are very much cautious about this thing. After this exam, you will be given GMC. So it's corresponding to the PLAB, the skills part. So about the examination, I couldn't finish any of the three. So the Chris pulmonary embolism, I went up to the middle of like circulation. I was totally slow because the patient was in very much pain whenever I was doing the pulmonary respiratory breathing part of this Chris. Patient was like in very much pain, something like that. So whenever I was checking it during the middle of circulatory part, the bell rang. And whenever the examiner asked me to summarize, so I just said, because the important thing that I was going to check the calf muscle after that to complete my examination. I think there may be some kind of calf muscle tenderness. Then the examiner, it's not like I would never comment on the examiner, but that examiner was pretty much like distracting the students in the morning session and also in the evening session. He was in the different station, like in the spinal one limb station in the evening session, in the afternoon session. So the fact is, he was like all the examinees gave something like bad review about him. But I think they actually do that on purpose. I actually heard that there may be some kind of examiners like that. So you just have to do, you don't have to lose temper during the exam. You just go whatever the examiners say, or you can just follow your instinct, follow your protocol whenever the examiner doesn't say anything. So after the Chris pulmonary embolism, then the hand examination, in that case, it was kind of ulnar neuropathy, was a cleaner. So whenever I just did the bimanual examination of the wrist, bimanual taking the tenderness at the wrist joint, he said some kind of tingling at the little finger. But after that, in the hand examination, I have only left the sensory one, and I have already done the grips and also the motor ones, Tinel's test, Tinel's sign, Phalen's test, all the things. Then the examiner ma'am actually asked me what maybe you're finding. So from I didn't check the sensation, I told you already that, but the fact is during the bimanual palpation on pressing the carpal wrist joint, whenever I remember that there was some kind of tingling and numbness. So it may be some kind of ulnar neuropathy. So I just said the provisional diagnosis from that. I think she accepted my diagnosis. Then I said the relevant investigation and all this. Then the bell rang about the spinal one limb examination. It was quite lengthy examination. So I just went with the all the station. I just followed the wiper that you guys already practicing every day. Wash your hand, gaining permission, be careful about the patient's pain and comfort and everything. So in this spinal volume examination, all the findings were normal. And the fact is, I actually went, I could not check the tone, coordination, and reflex, these three things, and I could finish up to that. So after that, there was no finding. The examiner asked me, what may be your provisionals? So there was a scenario. So it was saying that the ABPI normal and patient is not a smoker. There is low back pain radiating to back of the thigh and buttock. According to that scenario, I just said it can be L5 nerve root compression or L4-5 disc herniation, something like that. Then I went through the investigations and the treatment. After that, about the history. So also ma'am knows that during the history taking session, most of the time we actually couldn't finish it during the practice session. But ma'am, during the exam, I actually finished both of them. And I maintain this was my stations, ma'am. Like I maintain good communication with the patient, and I could summarize to the patient too. I could go up to that point. Also, like I could finish all the things. And the examiner actually, after 6 minutes, they asked me, like, would you like to add anything before the with the summary that you have done with the patient. So I didn't have to summarize again to the examiner. So the history was like that. So you don't have to ask all the differentials that are mentioned in our BuzzFeed notes. So you just have to pick up the specific provisional one and the important differential ones, not like in the osteoarthritis knee joint history taking. So we can find like at least 8 to 9 differentials. If you're going to ask all these things in one go, it can kill your time definitely. So the history actually went well with me with both the patient impotence and unilateral tonsillar swelling. Then comes the last procedure one, that is the chest drain insertion. So the station was like that. It's already all things are prepared, and you just have to put on your gloves before entering into the room. The patient is draped, already anesthetized, and the examiner actually said me that, but still I have started like talking to the mannequin that was present. Then the examiner said, okay, it is already done. So I also asked about the WHO checklist, consent is taken or not. I wanted to check the wristband. I actually follow my what I have learned from the procedure one. So then before starting, whenever I am just starting the procedure, there was an X-ray showing the lung border, right side pneumothorax, and then actually asked me about like where to put the chest drain, show me the safe triangle. I shown the boundary and told the examiner the boundary. And after that, there's an assistant of mine. So one of my seniors actually gave me advice, whenever you do the procedure, if you see there is some kind of assistant of you, so definitely just take a quick break, like 5-second break from the patient, like, okay, would you please mind if I just talk to my colleagues for a few seconds, then I come back to you. So you just say, hello, I'm Dr. Abhishek here. So I'll be doing this procedure. It would be very nice if you would help me. So it is just professionalism with your colleagues. So it just is actually one of my seniors' advice. I actually followed that. I just made a quick talk with my assistant. Then I started the procedure. He actually he helped me whenever I asked the scalpel, like which size of chest tube I wanted. He gave me, and the assistant was really good. And during doing the procedure, actually, sir asked me about what maybe the complications you would face during the chest tube insertion, and what is the nice guideline for inserting it, and after inserting it, what you would do. Then I put the chest drain. After doing it, I was securing knot. Then sir asked me, okay, before connecting it to the connecting tube, I was securing the knot. Then the examiner asked me, would you please, would you do it in this way, or you first just connect it to the water seal drainage system, then you will secure. Okay, then I asked, okay, sir, first I will have to connect it because I cannot keep it open because it may act like tension pneumothorax. It may turn into tension pneumothorax. Then the assistant helped me to connect it. Then whenever after the procedure I was putting the sharps in the sharp bin, then the assistant told me, okay, sir, I am just doing it for you. And after that, whenever I would remove it, the examiner asked me, I answered that question. Then the bell rang for that station. And after that comes the two communication. So my best performance in the skill part was, I think, like in the history taking with the patients, and also this communication ones. And the arthroscopy cancelled patient was like, I think I could manage the patient in a very good way. That we have practiced already with them several times. And about the dermal mastectomy, it was 100% similar with the scenario that we practice from our traditional notes. So only there was some difference, like if you just go through the wrong paragraph in this on BuzzFeed note, something like that, you would find that the daughter is a school teacher and busy with 2 kids. Also, she has a family to look after. She wanted to take her mom to home because so that she doesn't have to come to the hospital every day. So that was the reason. So the examiner, the consultant actually asked me that. So what do you think? Why the daughter has convinced her mom to go to home today. So I just answered that point. Okay, so I think it may be due to like the home is 60 miles away, and she has a family to look after. So she just wants to take her mom home so that she doesn't have to come to hospital every day, something like that. So this point was like from that stem is easily. So whatever we have in our hand, we should at least go through about the stem. So after this derma mastectomy, I think I have described all the things. So, ma'am, how was the examination actually went for me? And I was actually skeptical about this examinations 3 because they were like much longer examination, and I couldn't finish any of the 3. But people actually told me, okay, not mentioning, okay. So the people actually told me like doing that in 1 or 2 station, it never affect. But I would like to say about the London Center, to be honest, the skills part is like they maintain a high standard of high standard or high level of passing threshold, to be honest, because it's very hard for me. Like whoever I know, they couldn't make it in the skill session, like in my close to ones, like my juniors, like people from my country. So it's very sad for me. So I just wish that they could make it. And you know guys, like in the skills part there is like 180 marks, and in the knowledge part 160 marks. So the cut mark for skill part was like 115, and in the knowledge part it was 108. And I was very lucky, I got 119 in the skills part. So one of my seniors actually advised like if I would go for any kind of regional center here, so it would definitely make some more marks. So the London center actually make, like people say sometimes that pass rate is low, something like that. So it's not before the result being published, I couldn't understand that, but definitely you have to get full prepared and 100% confident if you go for this center. I would like to request. But if you just get 100% confident, definitely you can pass. You have to know that, because I actually did it like from overseas country, from Bangladesh. Like I was very much tensed about the exam, very much after also the examination. I was like I had planned like after the examination I would discuss with you people, but I was in a very bad mood. So I couldn't dare to do that. So it was like I had to wait for the result to share this experience with you. So my request is that, like, if you want to go for London, so definitely you just practice and practice. Oh, okay, my knowledge part result number was 148 out of 60, 160. So don't think about, like, definitely whoever in this here, if you go through the traditional notes at least 3 to 4 times, definitely no one can just stop you from passing in the knowledge part. But focus on the skills part first, because ma'am says that at least 30 times. I don't know how much time I have tried with ma'am in this session, like in the mid of 2020, when Dr. Jahangir, Dr. Meena actually practiced. I was like a listener, and I had a very scared mind to talk among these people. So the thing is, I have actually overcome. I have actually talked. I have started talking in this session. So that was my main reason. So to pass my weighty in March 2021 in first attempt. And also I think, like, if I wouldn't speak in this session, if I wouldn't talk to ma'am or talk to this session and practice with this ma'am, I would never be able to pass in this London center. So that is my most that is all from me, ma'am, about the exam. And if anyone have any questions regarding anything, they can also ask me, ma'am.
Yes, they are asking. Thank you for sharing your experience. You can take a breath or drink a glass, sip of water, so that you can
sure, ma'am.
Actually, there are many,
like,
yes. Yes, please.
Sure, you tell first, ma'am. No problem.
Yes, many of these members are appearing in England or London exam. So that's why they wanted to know your experience. So some of them have written, there are the two freely available traditional notes and basic notes, which I distribute as well. And then there are those famous paid ones as well. The first two questions, they are addressed to you, that they want to know which one is better, because I'm sure you did not spend money and you did not wasted your money on the paid courses. You just practiced with me and
no.
So what would you suggest them by just going with those freely available traditional notes, sing notes and the Bazid notes? You managed to pass, so with flying colors. So what was the success behind it? Like, what was the secret behind it?
Yes, ma'am. Yes, ma'am. The fact is, if we go through the sing notes and Bazid notes, like I have already, whoever has knocked me, I have told, like for the knowledge part, you have to go through definitely sing, because a lot of questions are there. And another note is mentioned here. I am not mentioning the name. Definitely all the people have this note. So these sing notes and the another notes other than the Bazid, you can take it. You can, you have to read these two notes. Yes, paid ones. You have to read these two together for knowledge station. Don't miss any word from there. Okay, don't miss. So how do you read for the knowledge? So first go through the paid one, then go through the sing one. Okay, so whatever the question is not in the paid one, you can just mark that in your sing notes. That would be the ideal way of the study, because nothing came. So there was a small question like, ma'am, if there is any precentral gyrus tumor, you can find it in the head neck in the last page of the sing note, head neck anatomy. So if there is any tumor in the precentral gyrus, what is the bone you have to go through? So okay, so if you have to take a biopsy, so it's just a single name, that is the parietal bone. So it was also in the exam. So I think the question was like from long ago, and there is a small question, but it came. So it also, it may contain like 1 mark. So it's important, you have to go through all the note. The key is you have to go through several times, because what actually follow here, the notes, these are nothing but the recalls that came in previous year. So there is no like explanation like the textbooks. So it's very volatile, and especially the anatomy. If you just don't go through like 15 days, you can see how much knowledge you have. I don't know if you are not like superhuman. So like at least less than at least 20 to 30% you will have if you just don't revise it a month. So my about the knowledge part, my advice would be go through the paid one and sing notes together, anatomy, pathology, and the critical care. Okay, for the examinations, communication, and examination communications history taking, you can go through the Bazid note. And about the communication in the bile leakage station, there are some extra questions in the paid ones. Sorry, there are some extra questions in the sing notes. You should follow some kind of ERCP related procedure. What is the benefit of that? So you have to go through that. And about the procedure one, as someone actually asked me, what are the procedures that actually come that we have to prepare for? Trust me, I just thought that chest drain is the last thing that would come in the exam. So it came. Okay, so in the sing notes, where the procedures are there, you have to go through all the procedures there. And my advice would be, like, the topics are there in the sing notes. You can go, you can follow the procedures from this, the Dr. Academy book and the yellow book, all the red book, the clinical and procedural skills. That book is very good, and all the basic surgical questions are written, and all the checklists are written in the books at the end of each topic. Yeah, ma'am. So definitely go through that book. So it will really help. So that's actually a study material.
Can you please repeat the name of the book?
Raise hand and ask questions so that it will be systematic.
Yeah, that is the clinical and procedural skills book from Dr. Academy.
Yes, it's given in my handout. That guide that I've given, it's like PDF is attached. You don't have to buy any books. Everything is available.
Yeah, yes, everything available. So you just have to practice the skills part, the communication ones. That is the key to success. And no one can stop you from passing knowledge part. Trust me, if you just go through these two books, no one because all the easy questions are there.
Yeah. Right. There was some question number 3. Someone asked you about the knowledge part. If
Okay.
you can
Which one, ma'am?
answer questions. Some iPhone is asking questions from knowledge part. Are they the same as in the notes, or
Question for knowledge part as the same as the no. There was no new question, brother or sister. And the fact is about the newest sessions that came 2021, I already shared my notes. So you can just follow that. If you just, I actually followed because that station came and I compiled those. But in the February 1, no new station came, no new station.
And there is another question, actually, personal experience shared by doctor. Yeah. Doctor wants to know, need guidance and advice from me. Okay, I would say join the revision sessions. There's so much that I cannot write in the guide that I've written, but I can explain it. And the key is to be regular. Dr. Abhishek is from Bangladesh. He has revealed himself. So the time difference in my revision and his time, it's a lot. People say 4.5, 5 hours ahead, Bangladesh is. Still, he was always regular. He was punctual every day. Like, if I'll miss. If I'm there, he's always there, the first one. So punctuality is something which Dr. Abhishek is not telling you. Being punctual, being regular in revision, not just attending my meetings. This is something which gives the result, And you learn a lot by listening to others. So many people came, they gave exam. He couldn't travel. So he was listening. He was observing, he was practicing. So that's how he learned and improved himself. Like his preparation in the beginning, I told you it was so good that I had to tell him that, fellow brother, you practice yourself. If there is any problem, then come to me.
Ma'am, I sometimes got pissed off. You couldn't
I know,
give me any station.
I was so straight.
Yeah.
I told you honestly because I knew your preparation is very good, and if I'll invest my more time on you, it will not be this, like, it will be unfair with the others. I'm sorry, but I knew you can do it, because after such a long time I observed your pattern. I knew nothing can change your preparation, or because it's like, even if you'll not study, your residual knowledge was good enough. So someone raised hand. Yes, please. I'm sorry, Dr. Santosh. Yes.
Yeah, please, Dr. Santosh.
Hello.
Yeah, please.
Yes, please.
Hello.
Yeah, sure.
Hi.
Yeah.
Hi, ma'am. I'm
Hi.
Santosh.
Good evening.
And
Yes.
actually, good evening, ma'am. And I'm not new to this group. I wrote exam with Meena, ma'am, long back in 2019, January, Hyderabad.
2019, not 2020 January.
Yeah,
19
it's
or
20.
20.
Yeah, it's 20.
Yeah.
Okay.
Because I went there after your exam. I went there for a 1-day course, okay, Hyderabad.
Okay.
So that's why I remember.
Right, okay.
The thing is, yeah, ma'am. That time, actually, I attended your classes, but I was not regular because time was problem. But I practiced with Meena, ma'am. It helped me a lot.
Yes.
And what I say is, I was not prepared well at that point, not fine-tuned my skills. Like MRCS part with their point to point. If you answer that point, you will get the mark.
Yes.
I was not fine-tuned, but still I gave the exam. I got cleared in knowledge, but lost skills by 4 marks. Means it was for 2 marks. So I got 126 out of 130. I should be passing mark.
Yeah.
That's left. Then close the international centers for COVID. I didn't get the time for studying again. Then that's fine. Then I came to UK as a registrar in through MTI program from India in orthopedics, and I'm working now. I'm supposed to write the exam as early because I could not write. I was settling in UK. So I wrote in this February in London. You, Abhishek, you gave the exam on 8th. I gave the exam on 13th February.
Oh, okay. I see.
But what I could notice is in London Center, I last exam I didn't notice. This exam from last few days, that 7-8 days, they're repeating the stations. Every stations is repeated.
And there was nothing new.
Nothing new. Even the question. Yeah. But but still knowledge I passed by 127 and skills I got only 115.
Yes.
But my problem I faced in is like, I thought in the one part of the knowledge I'm not talking, but it's understood knowledge. What I've seen is the IMGs, like we do well in knowledge, and the British trainees, the trainees who are working here doesn't do well in knowledge, but they do well in skills. They're too good in skills.
Yeah.
Because my worry is, even though I wrote second time, I know what's going on, but still I got 115. So my worry is because my experience in skill stations is, I started with my skill station. First station is history taking. That is shortness of breath, anxiety, due to hearing about the cholecystectomy. That seems to be went well, and I finished in proper time because I had a protocol in my mind. I had made my notes. Okay, when before reading the few questions of differential diagnosis in mind and go there. Went on proper times in traditional notes. That went well. Next, pulmonary embolism went well. I finished everything in time. I like what you say, I palpate exposure A, B, C, D, everything. Then he told, yeah, I'm done with exam. He showed me the ABG findings. Then he said, what is the condition and what you want to do and what investigations you want to do. Everything went well. Then station comes is communication. In communication, S-bar. The most important thing is in S-bar, in traditional notes, we don't have a clear S-bar notes. Each endpoint they'll ask. But normal findings, that's fine. The other findings.
What was your phone call? What was your
phone call? Was mine is derma mastectomy.
Same.
Same. One thing I left there is, as you said, why the daughter has been calling mom to come home. Okay, I got confused. Really, I forgot. I told she has a child to work and she works 2 jobs. So many things I told, but she was not confused. The examiner didn't accept it. And one more thing, whether she wants to take the mom to her home or her home. There I got confused. These 2 things I got confused. But the rest of the things, like I'll investigate for DVT, I'll investigate for everything I spoke. Then last thing he told, how do you do that? I told, I'll do legally, I'll ask them to document, tell the safety netting advice, saying like,
the complications can happen.
Complications can happen. How do you document? He asked. I didn't know that. Then the phone, the bell rang. Then I moved to next station. Next station was a communication angry patient.
Angry patient, that's arthroscopy?
Arthroscopy, yes.
Yeah, arthroscopy, same station.
Same station.
Where it looks like it went well for me. It went like to a point. Last question was, anyway, I have to complain to someone. Tell me who I'll complain. He asked. Then I told, understood, sir. I understood your concern, but still, since we have emergency prioritized surgery, so we can't do it today. So we will let you know as soon as we made a team meeting and we'll put you on the list. But he told, I won't complain. Whom you will
the answer would be pulse, actually.
Pulse, exactly. See, these are the small things that you're realizing yourself. These fellows, they were regular with practice with me, so they knew it. They have discussed it. They knew it. Once you're preparing yourself alone, then there's no one to correct you. Here, maybe people say, okay, they feel embarrassed, they have to talk, they make mistakes, but then that is where learning takes place. When you make mistake, others correct you, you learn, you adapt, then you improve.
Ma'am, rest 3 gonna tell. I won't take much time.
No problem.
The 3 stations which I went very bad is history taking, inflammatory bowel disease. She told me one thing. She told me she is very embarrassed to have this problem. But at that point, I showed a concern like, yeah, I'm very sorry to hear that.
Yeah.
Let me see what we can do for you. That's all I told. That is one thing. But I don't know I'm right or what. Then I moved on. Then I asked the diarrhea questions: how much, what, is there any blood, and everything, extra intestinal manifestation. I asked everything. But
Okay.
here in the stem, they mention only diarrhea.
Okay.
In my mind, I practiced before to ask the abdominal pain, but I forgot asking the abdominal pain.
Oh,
But I asked
okay.
everything. I asked past history, family. I asked drug history, medication, allergy. I asked extra intestinal. I asked systemic history, idea, concerns, expectations, everything. But I
Yeah.
forgot to ask abdominal pain, and I forgot to ask the
Yeah.
Socrates
The
of the
pain
abdominal
related
pain.
questions actually. Yeah.
Exactly. Yes.
Because in the stem, it made me think like I'm going only with the diarrhea. Then
Okay.
the
Okay.
examiner intimidated me. He told me to present. Then I presented. What do you think he told? I told it's inflammatory. I feel it's my professional diagnosis, inflammatory bowel disease, but I would like to give other differential diagnoses like IBS and
IBS. Yeah.
CA colon, like that. Then he asked, why most common in this UK, what is the main problem? Why you went asked? He was expecting malabsorption.
Oh, I see.
He was
Okay.
expecting malabsorption. There he stuck me there. Okay, I
Okay.
told, okay, yeah, yes, okay, then bell rang. That's it. The station went like that. This is the one bad station I had.
Okay.
Next station, knot tying. I was not okay with the knot tying because I practiced
Of
without
course.
gloves.
Of
Gloves.
course. Yeah.
And I didn't attend any basic surgical courses, but still I learned it from my friend.
Okay.
And I tried. First, not without depth, I could do it. With depth, I was very scared because that will come off the thing. I was very scared. I took very time. I was struggling. He could see me
Okay.
struggling. That's okay. Then the hemostatic knot, I did it. Then he asked few things like what is that, what is ilk, what is
Yeah.
vital, what do you tie with, and what do you do that, and how, if it is in depth, what do you do, and everything. That I answered.
Okay.
That station also I'm not satisfied because I didn't do in like fully flying things. Next next station is hand examination. That went well. And then examination is spine examination. Here I did everything except I could not use the props of neurotip,
Okay.
and I could not examine one more thing. I think the heel and shin coordination.
Coordination test. Yeah.
I- Otherwise, otherwise I did everything. Here she asked me everything. I answered everything. Next is catheterization. Here I made a blunders because I first of all it started with wearing gloves. My hands were sweaty. I could not wear gloves properly, and I could not wear the apron. Then I went gloves with his torn. Then I could not wear the apron. I went inside. It's already written in the station like stem. It's already prepped and draped. But still, I introduced I'm this and this, and then I asked his name, confirmed his name, and I've told I'm going to do this procedure. I've explained how the procedure involves. He asked me water. He wants water. I don't know why he asked.
Because
Then I looked at the examiner.
yeah.
Yes. It,
Because
yeah.
stem says he's coming with some diarrhea and everything. He's a young boy, diarrhea
You
with
have
him,
to give some
everything.
IV fluid. Yeah.
Yes. Mm.
Yeah, something there.
Oh,
Then
sorry, fluid
I
monitoring.
started.
Yeah. Yeah.
Then I started doing the procedure. Then I acknowledged the examiner. He's gonna act as assistant. I told him, "You're gonna help us. It will be very helpful and everything." That's fine. Then I started doing the thing. Catheterization. The prepuce. I thought it's retracted in the mannequin
Okay.
because it was half open. Then he told, "Have you retracted the prepuce?" I told, "Yes." "Oh, yes." Like that, he made him intimidating. He told, "Oh, you retracted?" Then I retracted. It's going out. It's going back. Oh, okay. Then I put the jelly. Then I put the catheter. Then I forgot to inflate with the distilled water. Then I connected the tube. I'm seeing for the urine. Then he told, "Don't you want to connect the tube?" Then I got tensed there. When he was telling like, you didn't do that, you didn't do this, like that. When he was asking, I got tense. Then I put the, secured the catheter. Then the bell rang. Then the other examiner called me. He asked like, what do you want to do? Then I told, I'll document in the notes, and I'll document how much the urine is come and everything. Then he told, you will go to the ward and nurses calls you to put the catheter. What is the first thing you will see? I could not answer this question.
What was the question, brother?
Tell now.
What was the question?
So nurse will call you to put the catheter. What is the first thing?
No. What is the first thing?
You will see before
yes.
catheterization. You will see. I told a lot of things. I told I'll see for the bladder examination. I'll percuss and see bladder is full. I'll see whether he has had enough fluids and everything. But he didn't, means he could not get the answer out of me.
Okay.
And the bell rang.
Any type of contraindication of catheterization you mentioned?
No.
Or contraindication like any blood in the meatus or any, one is saying,
So
Dr.
you look
Sanullah
for
Khan,
the
the latex
latex
allergy.
Yes, that could also be.
Yeah,
But
everything I
opening
asked in the first only. I asked the latex allergy and lignocaine allergy and everything I finished. I went in order. This was like, what is the first thing? What I could think of is two things. One is bladder scan, or it should be either it should be intake output chart, something. I could think of only that. I could not get answer from anywhere. Then I was like totally irritated, because he took me like a gun position in asking, what is that?
Okay.
Because
he could have gone further and
oh no,
he got
my
your
examiners.
Weak point. He got your weak point that this is.
None of my examiners were like that, to be honest, ma'am.
Once
so
you are less practiced or
only
trained, they'll figure it out. They'll figure out. This is not the first time they are doing. That's why I tell everyone to practice 30 times.
Yes.
Once you have practiced enough, then you can just go flying colors. If you have not practiced enough, they'll figure out your weak points and they'll just hammer you there.
Dr. Santosh, 115 was the cutoff mark, so you couldn't make it?
No. The marks I got is 115.
115.
Yeah.
115 by heart, it was the cutoff mark. So
for your day, Dr. Abhishek, for his day, maybe it was 116.
Oh,
you are competing.
Yeah, ma'am. I heard two, remember? Actually, 116
yes.
and 115.
Yes, you are competing against your own fellows. Like maybe the people on Dr. Santosh's day were more intelligent. They scored more.
Yeah. I think so, ma'am. I didn't know that. It depends on others' performance.
Yes, exactly. That's why
I was going to say that. Yes, ma'am. Like it totally, Dr. Santosh, it totally depends on like on your specific day, how your co-examinees actually perform, to be honest. So definitely that's the main factor.
Because one more thing I'm gonna say is that this is one of the paid courses. How I prepared very well compared to previous preparation. When I discussed with Meena ma'am, she's too good. She helped me a lot because
she's nice I didn't. As well.
Yes, ma'am. And this time, since we are in UK and one more guy is come with me, we came houses every week, 2 to 3 days, and we practiced on each other. It was like exam. We step out of the door, we make sure that timer, then we did it. It was so good preparation. And in exam, after everything, I thought, okay, 50-50 something. But if it is a cutoff mark, then it could have been passed. It depends on others' performance, means it's very difficult, because if others do well, your marks is difficult.
Yes.
So only thing I could say is you should try to achieve you should not make minor mistakes. You should achieve to the bigger score, but we will do it. But Only one thing is my friend got 139, I got 115.
Oh,
And one
same
more
day.
girl.
Same day?
Yeah, same day. And
Okay.
one more girl, I don't know whether she did it on same day, but one more girl in one of these paid courses, she's a British trainee, she got 163 out of 180 in skills.
Oh, okay. Some kind of
But
superhuman.
no,
Definitely.
no, they
No,
should
it's the way
not be
you do it.
Abhishek. They should not be a superhuman.
No.
What is the difference between we and both? See, normally this MRCS part B is like everything has been already, we know this is gonna come.
Yeah.
But still, why she got 163 and
Yes.
why we got, why I got 115, why my friend got 139.
It's
It's
kind
the
of
way you
open
present.
open
Yes.
secret, Dr.
No.
Santosh. It's kind
Yeah.
of open secret too. So
Ma'am,
we
How
all
you mean,
know
Dr. Abhishek?
yeah,
there. I mean, actually, definitely if your knowledge, your performance are well enough, you can definitely make it pass. But it has some kind of definitely they're obviously skilled. I'd like to say obviously they're learning more from the uh, and they are learning more from the FY2 level rather
yeah,
than
that is yeah.
our country's internship system. But still, there's some kind of more marks they attain because I actually got acquainted with some of the examiners that were they were British, and they actually all around actually they got 140, 143 this type of marks. So actually, ma'am, we gave our best and we tried our level best, and definitely we can never do the exact communications and skills like they do. But to be honest, sometimes definitely they have some point to favor. Yeah, I may be wrong. But still,
No.
it seems like that, ma'am.
Yeah. What I could think of only solution is I want to know like where I've gone wrong. So I
Yes.
emailed the MRCS guys and to know like I've heard they'll send a test report for
Yeah.
to make sure where you have gone wrong. But I don't know. These people are very late. Before booking the date, whether how many months it will take to come, I don't know. But I mailed them. I mailed on last Friday because we got results on Friday. So I'm waiting for the response. If I get it before I booked for exam, the next exam, it will be very helpful. So to cover up my areas. But only one
And
thing is,
yeah, sure.
I'm going to see is like I'm gonna join ma'am's class, so it's gonna helpful. So everyone can point out my mistakes. So it will help me in
Yes.
scoring few marks what
More.
I'm
Yes.
lacking. So that
Yes.
Yes.
could
It's
help
a
me in
good
passing
idea.
it next attempt.
Yes.
Yeah.
It's
Yeah.
a good idea.
And another thing, ma'am, to be honest, on my examination day, definitely whenever you give exam, you can understand whoever is British examiner, whoever is examiners from our subcontinent. So the examiner I have told about about the pulmonary embolism, crisp. So there was typical finding like some kind of localized chest pain, and only the chest pain one that goes with pulmonary embolism. And if there is shortness of breath and shoulder tip pain, it goes with the anastomotic leak. We already know that. So whenever in that examination station, I think there was a Pakistani examiner. So actually, whenever this type of thing happens, most of the time, people actually shared our subcontinent examiners. Actually, they sometimes there was kind of rude behavior, something like that, or distracting behavior, something like that. I'm not complaining. Actually, the British examiners, whenever after the examination, the people are there like from the Royal College to observe the examination, they asked about the feedback. So we IMG actually we never did any kind of feedback. We just okay, the examination went whatever went. But the fact is some of them actually wrote review about the examiners who were they were less cooperative cooperative, and something like whenever you try to escape some questions and answer that later, somewhat some didn't take about that proposal. So actually the British examinee also they were the one, they made some review about the examiner. So my first and foremost advice would be, if you are just well prepared, nothing of this actually matter. And first of all, before starting preparation or during doing preparation, just put it off from your mind. So whatever I have said, this can happen or this can never happen. But if your preparation is well enough, definitely no one can stop you. But I'd like to give some like caution about the UK Center. So you have to be very well prepared before attending. Otherwise, it can be a because 5 of my closest one I know, they actually all did they couldn't make due to this skills part, like with 112 marks, 109 marks, this type of marks near so close they were. So that would be my advice, ma'am, from my side.
Yes. Now we have Dr. Abdul Aziz has joined. Good evening,
Yeah,
Dr. Abdul
sure.
Aziz. Congratulations. Can you
Abdul, congratulations.
also share with us your experience of your success?
Good evening, Ma, and good evening,
so happy
everyone.
For you.
Yeah.
Yes.
Yeah.
Congratulations.
Yeah, thank you, Ma. Yeah, thank you, Dr. Abhishek. Congrats.
We talked on on the you were that Dr. Abdul. We talked on the Telegram. Sorry. Yes. Okay. Okay.
We had interactions before the exam.
Yeah.
You gave in the same center?
First of all,
both of you were together? Like
no, ma'am. No.
All right.
I did at Coventry, that's Edinburgh College.
Yes.
So first of all, I want to give all thanks to Almighty Allah.
Yeah,
then,
sure.
Secondly, I want to thank Dr. Samri Malik. You've I don't think I'm short of words. No, but Ma, what you do, it's exceptional. Because you give a lot of guidance, and this is one of the most important things in this exam. Because I even realized even some of the questions were even simpler than what you give us. So if one follows your discussions well, you get well prepared, because it's like you're getting what is more difficult, and eventually when you get to the exam, if you can get focused and be calm, you can even look at the questions as easier questions. So, and I also want to thank everyone that has contributed here, because I used almost all the videos to revise a lot of discussions, questions that were asked, how everyone responded here. I used them for revision. So everybody has been so important in this success. So it's just not, just not myself, not just Dr. Samri Malik, everybody that has contributed. You might not know, but it's the fact. So for the exams, I think I saw what Dr. Abhishek posted. His exam is exactly the same with mine.
Okay.
Same stations. Yeah.
Same stations. See, this is for the juniors.
The same.
Yes.
Yeah.
Yes. So the thing with the exam is, I think the first thing is, if you're writing, the first advice I would give is, if you're writing on maybe the later days, maybe if you're not in the first group, like Edinburgh College, they wrote around February 15th, 18th.
Yeah.
You can actually look at the pattern to have a sort of preparation. Okay. We realized tonsillar swelling was coming out every day.
Yeah, every day. CVP pneumothorax every day.
You see tonsillar swelling, hand examination, and so that way you can exclude some other areas, but it can be risky anyway. Yeah, but you just have a guide. So my advice, actually, because I realized I've not seen my breakdown, but I was actually scared of the skills part.
Same here, brother. Yeah.
I was scared of the skills part, because what I realized is, for the procedures and also the examinations, the examiners, they don't score you while you are there. They don't score. That's what our examiners did at my center. They don't score you while you're there. So what they do is you just do your thing. When you leave there, I think that is when they score. It's not like, okay.
It's not like during performance. Not like during performance.
Yeah, it's not like, okay, you've washed your hands, one, you've done this, one. No, they just look at you. So my first station was chest tube insertion.
Okay.
So immediately I got there, I saw the mannequin and they said, okay, turn your back, don't look. So I started having a recap. Okay, what am I going to do? What am I going to do? So once you go to that exam and not be stereotyped.
You should be free and professional. Yes, I agree.
Yeah, just be free and professional. Be very open. Anything can happen. So immediately immediately they rang the bell and I got there. The man was like, okay. So I thought, okay, you pick those instruments and you pass the chest tube. So I wanted to pick the instruments and he was like, no, take this chest x-ray.
Yeah, first of all, yes.
Started discussing the chest x-ray. The next thing I thought, okay, allow me grab my knife. Let me pass the chest tube. I was like, no, what's the safe triangle? I was worried. Yeah. I started panicking. So what's the safe triangle? I gave him all. Okay, where else can you pass chest tube for pneumothorax? If you have a tension pneumothorax, I told him, okay. So he now said, okay. And
doctor. Also, why whiteboard chest tube? Why whiteboard this question too?
Yeah, the size and all that. So I now told him, okay. So he now said, okay, you can now pass. Pick your instruments. So I picked the chest tube. I picked the sutures. I want to check expiry date. I was following all those protocols. He was like, okay, doctor, go ahead. So I now told him, okay, I want to test if the anesthesia has taken. He now said, okay, go ahead.
Yeah, that was important.
I also want to tell the patients complications. He was now like, okay, let's discuss complications. I was now worried. He said, okay, let's discuss complications. What are the complications?
During doing the procedure, they asked that.
So he didn't allow me to pass the chest tube. We're still discussing complications, and it was 5 minutes already. So I was sweating. I thought, I think I failed this station. So when it was 3 minutes more, he now said, okay, pass the chest tube. I said, okay, I need an assistant. He said, don't worry, I will assist you. Very nice examiner. So I started doing all the normal protocols and okay, I made an incision, I passed the tube. Immediately I passed the tube and the tube went in. He wanted to know where I would stop and all that. So why I'm discussing this station is because what I didn't do. That is why I'm discussing it. So immediately I passed the chest tube and I secured the tube. They rang the bell. And I was like, this is a disaster.
And that was
I said, this is a disaster.
I don't think that was a disaster, Dr. Abdul.
No.
Because
because I mean, it's my first time. You understand?
First time.
So I felt I've not connected the tube. I have not maybe put water in the tube. I have not discarded my shafts. I have not dressed. I have not done post-intubation x-ray. I have not given post-procedure instructions. I said, no, there are a lot of things I've missed. So he now told me, he said, okay, doctor, you want to connect your bottle, right? I said, yes, sir. And I want to discard my shafts. I was saying it far away.
Yes, that's good.
So I realized he's a nice examiner. So most likely he scored me well there. So I was now panicking, which is also what we shouldn't do. Once you leave a station, just allow it go. I didn't allow it. I was now thinking. My next station was hand examination. And that one was now a disaster for me because I was panicking. I didn't do ulnar. I didn't test for ulnar nerve. I didn't do Fromet. I didn't do all the interossei and all that. And I also did not even investigate and I didn't manage. I said the patient had the carpal tunnel syndrome. And when we got out, everybody was like, it's ulnar nerve. It's ulnar nerve.
Yes, ulnar,
I said, no, it's over. This exam is So I felt, okay, no problem. Let me move on.
Yes.
So other examinations were now back exam. I had to brace up. I had to ignore because I felt the 2 stations I started with they are not so good. So I need to get something going. So the respiratory exam was crisp. And I heard Dr. Avishek describing that. It's quite technical, but we discussed all this here. I remember a lot of people asked questions, and Dr. Samri Malik, she actually addressed how we're going to do it. You treat it as a critically ill surgical patient, so you don't do a full respiratory exam like that. But the examiner was also not so nice. When I told him I need an assistant, it's an emergency, he said, I don't know. I'm not here.
Oh my God. Ma'am, same here, same for the examiner. Yeah, he was like that.
So I was like, okay, no problem. I'll be doing my acting, but I know you watch me. So I was talking to the patient. I looked at his name. His name was written on his wrist. So I told him, yeah, Steve, don't worry. I'm here for you. You'll be fine. Okay, all right. Let me take down your mask. So I felt, if you like, don't listen. I'm talking to my patient. I'm not even talking to you right now, because he was as if he was not interested. So I was also doing my thing, but I made sure. So at a point in time, he'll be looking at me. Once he sees I'm looking at him, he will look away as if he's not looking. So the catch in that station, yes, is to squeeze the calf. Once you squeeze the calf, the patient, because they covered it. They covered it with the, I think just covered the limbs of the patient. So once you just open it, you take permission and you squeeze, because that's how you can get your diagnosis, which is probably pulmonary embolism, and then you can manage. So that was that about the examination. Then I think the other areas that I feel is also quite difficult for we Africans, Asians, that are not too used to their system is the communication station and the history. So I had the privilege also, because of, I listened to all our discussions here, because I grouped them in a playlist. I had all the phone call stations. I just click on Samri Malik, all the phone call stations come up on YouTube. So I listened to everything a day before, all the mistakes. I listen to maybe a DAMA patient. I listen to 3 different people that answered it and how you corrected them. So it makes it more, I have, okay, this is what you're supposed to say. This is the mistake so-so person made. This is the mistake so-so person made, and these were the corrections. So what I realized is that the thing with the communication station is there's someone for empathy that gives you 5 marks. So you can get cheap 5 marks if you have empathy, you show empathy. And also you have someone that will be scoring you for, like we had the angry patient that was so angry, was very angry. And
very angry,
And I remembered I heard something on this platform for the very first time, which is what I used. Immediately I got there and I introduced myself. I confirmed his name. I told him, Mr. Steve, I'm very sorry. I know you've been fasting. I heard it here first. I've forgotten the person. It was very, I said, I know you've been fasting. I don't know if you'd like to take maybe let me get you a glucose drink or something. So
that was important. I mentioned it. It was discussed, ma'am.
I
heard it.
It's not in the Bazid notes.
No. That's what I'm saying. It's important to come and revise. Yes.
So when I heard that, I used that, and well, of course, he didn't accept my drink. I knew that. He said, no. I don't. Where?
My patient accepted.
So
yours accepted. Okay.
Yeah, ma'am. He was very cool after my counseling, so I was quite happy after that station.
My patient was very angry, but then I realized he might not ask some questions, but you have to take note of what was written in the notes, because he didn't tell me he was gaining weight, but I knew they wrote it there that he has been gaining weight. So I had to bring it up that, okay, I also noticed that you've been gaining weight, and I think I'll recommend some exercises and this and that. So I had to bring that up. Then we talk about the diclofenac and all that. We talk about that. All those ones were in the notes actually. But the thing is that there are certain things that are not in the notes, and you just have to be flexible and interact. Just like the phone call. The phone call station also, the man also had was lumpectomy this time around and not mastectomy.
Oh,
so if you go with the mindset of mastectomy, you just go and tell the consultant, yeah, my patient had mastectomy 2 days post-op, because that's what has always been in the notes.
Yeah.
But it was a left lumpectomy.
Mine was right-sided mastectomy. Yeah. So the stem is always important. You have to go through this.
You have to, don't be rigid.
Yeah.
So I now noticed something, and someone told me before the exam also that I should make sure I don't want that patient to go home. So the examiner kept on asking me, okay, doctor, you said the daughter wants to, okay, does she have the capacity? I said, yes, she has. How did you test for the capacity? So I had to tell him mini mental state examination. So that is how another information can come into a different topic entirely. So he was like, how did I calculate? How did I get the capacity? I said, I did a mini mental state exam. So he said, if it's greater than 26 and also this abbreviated
score system,
it is more than 6. So he was not like, okay. Do you want the patient to go? I said, no. I said, sir, I would actually want, if a more senior person can come to them to talk to them. He was not like, okay. But do you still want them to go? I said, no, I wouldn't want them to go. He kept on asking. He now said, okay, what if they insist? That is when I now talk about the form,
complication,
and
everything.
I would advise them on and complications and all that. So I realized they actually, I think the way they mark those communication station might not be stepwise. It's how you end in the long run. If you end in a way that this patient is safe in your hands, you might get good marks. That is what I feel. Because he wanted to know if I will allow that patient, I want that patient to go. I think he wanted me to just say it that, yes, if they want to go, no problem, I'll give them the form. But I insisted that I will explore all the options to make them stay, which is, I want to call a more senior person, but they said my registrar already has already spoken to them for like 20 minutes and they did not listen to him. It was written in the notes. So I also told him that, okay, that, well, if they now insist, because time was running out, I had to use that opportunity to talk about complications and all. So I realized that was how that one went. And the history taking also, which is another important area in the skills, what I did for the history that someone told me to kickstart everything is that I shouldn't just start with, okay, you have a swelling. When did it start? How big was it? Immediately I got there, I introduced myself. I was like, okay, can I call you Steve? Yeah, Steve is okay. I'm like, okay, so Steve, can you tell me about this swelling? So that is what I just did to start. Can you tell me something about this swelling? So those actors are well trained. They will give you a lot, they will give you very good history. A lot of things that you wouldn't ask again. So it was not like, yeah, doctor, I noticed the swelling, about 3 months ago, and I've been disturbed. So it will give you a lot of info. So wherever it stops, you now pick it up from there. Because now I don't have to ask again, when did it start? He has already told me that is 3 months ago. So I realized those actors, they have all the information, but if you don't ask them or you don't allow them talk and you want to be asking the questions, it should be an interactive thing. Like the man with the impotence. The key thing is you have to know that he actually lost his job before that impotence. But if you don't ask, you might not know. So I was like, okay, prior to this happening, can you just tell me, was there any issue around that period? It was not like, yeah, doctor, I lost my job. So immediately I said, okay, this is time to get marks from the empathy examiner. I was like, oh, I'm very sorry about that. I'm very sorry for the loss of your job. So it's all about acting. So so really said that. I said, okay. And he's also hypertensive. He uses atenolol.
Yeah.
So then when I want to talk about ice, what I did again, I don't say, okay, what are your ideas? What are your concerns? I'll just be like, okay, do you have any idea? Oh, okay, yes, this. I said, do you have concerns? And what are your expectations? I combine them. So it looks like a statement. And he will also answer as such. He will give you, yeah, I'm concerned. Yeah, that's why I'm worried. This, yeah. And that's why I've come to you. I want you to be like, okay, don't worry. You're free, be very free with me. You can talk to me. You rest assured, I'll try my best. So that is also history. I think history, we shouldn't be dogmatic and look at it that we want to ask all the questions. Yeah, I want to ask about night sweat. Yes, you will ask, but there's a way you interact and it flows. You understand? So like if you ask, okay, you said you've been having night sweats, you've been having this, okay, have you also noticed any change of voice? So you you say some of the things again and you add some other things. So it looks like an interactive session, because from my experience, I realized the communication and the history is where we all struggle. So I felt, okay, let me try and do my best in this area, so that because I'm not English, I'm not like the English guys that they can actually handle this area as well. So that was how I handled the skill session and then the procedure. And I think another lock one can have in the exam is if your procedure station, the second one is operation list, is just like a knowledge station. So I think you can.
My first one is that.
Yeah, you can score high marks, because for someone that is suturing and someone that is to discuss operation list, I think is not the same thing. Operation list, we just ask you, arrange it. Okay, how will you prepare each of the patients? So it's just like a knowledge station. So you can actually score very high marks and is under skills. So I guess that was one of the luck that we had again, having operation lists and having prepared also. Discussing operation list. So it made it a lot easier, because if you are panicking and maybe you want to tie a knot, you might lose 1 or 2 steps. They might mark you down. But when you have stations like operation list, if you've read it, it's just like a knowledge station. And so because the knowledge stations, once they ask you your question, they just want an answer. And if you explain so much, you'll be losing time, because that is what affected me in one of my anatomy stations. I kept on asking a lot of, I was like, okay, is this right or left? He said he doesn't know, because the pictures are very funny. They do those pictures as if they want to confuse you. So I said, is this right or left? The man was like, he said, well, I'm not going to tell you that. You figure it out yourself. So I was losing a lot of time. So by the time we got to popliteal fossa, they just rang the bell. And he wrote it right in front of me, 10.
Oh.
So I was like, wow, 10 marks is gone in knowledge. Yeah. So my exam is over 150 now. He wrote it in front of me. He was even writing it 1, 0, 1. I was seeing it 1, 1. He didn't cover it. So I knew that, okay, I need other stations to be close to perfect. And like osteomyelitis, I remembered the one we had here. It was even Dr. Tolu. I can remember. It was the one that had osteomyelitis. And so, so it's not as if maybe I'm praising the Samri Malik forum, but it's just the truth. When you follow and just get lucky. So nearly I got there, I was like, oh, osteomyelitis. It was Dr. Tolu that had it, and he had a very good session that day. True. Dr. Samri Malik was happy with him, and
there were some silly questions in osteomyelitis, like what is the reason, what is the cause of abscess? Okay, so it was like,
they asked some very,
tell me 4 organism of osteoma of abscess, something like that. I was like, okay.
They asked some there are some questions that are not actually in the notes, but
But that was answerable. If you just
yes, answerable.
Yeah, true.
I think one shouldn't be that rigid also with the notes, because like the man with the gastric cancer, the examiner was very tough. If you give him a good answer, he says no. He said vitamin B12. I said okay. I think because of the intrinsic factor. He said no. So he wanted me to stay there. I said, okay, sir, please, can I come back to this question? Because he wants me to stay there. And if I stay there, it's just 1 mark, maybe, or 2 marks. So it's better I finish all the questions, then I'll come back. So that is also another tactic of the exam. Don't allow the wicked or the strict examiners. I withdraw the word wicked. The strict examiners, they want you to stay on that question.
Yeah, so some of them did not permit that. Yeah.
If you don't move away, they will stay there and your time will go.
True.
So the smart thing to do is that tell them you will come back. So when I finished all my questions, I now told him, I said, sir, is there any question? He said, yes, you've not answered the vitamin B12. You've not answered the ascites. And I told him, I said, well, this is the answer I feel. He said, no. So I felt, okay, well, I'll wait till they ring the bell. I think there's nothing I can do. So, but I knew I had finished all the questions. And so if it's 2 to 3 that I could not answer, I feel it shouldn't be a bad station. But if I had stayed on that particular question, I wouldn't have answered the other simpler ones. So that's another thing we should learn. We should always, once you don't know a question, just politely say it that, please, sir, can I come back to this question? They will be glad to allow you. Okay, no problem. We'll come back. And you can even ask that, like one of the anatomy that was quite good. The man was even gisting with me for like 2-3 minutes. Okay, are you Nigerian? Okay, all right, okay, good. Yeah, okay, well done. Because I also asked him again. I said, please, sir, is there still any question? He said, well, if you want to change anyone, but I think you are fine. I said, no, I'm not changing. Yeah, so it was a nice examiner. So I feel those are just my, because I feel for the knowledge part, there's really nothing much once you read well. And the thing is, you have to take note of the answers because you don't have the luxury to explain so much. What is subclavian still? Once you say it, they give you your mark, it's okay. Some of them will tell you it's okay. It's okay. You understand? Because you've gotten your mark. Don't go further and start saying they have these are the symptoms. These are he asked you what is subclavian still. Once you get it, he will just tell you this. And if you're identifying something, you'll be like, okay, what is this? I said it's the vagus nerve. He said, vagus nerve? Are you sure? I said yes. He said, okay, look at it well. I said, okay, right vagus nerve. He said, good. You complete your answer. Tell me if it's right or left. You understand? And there was even that same examiner told one of my colleagues, I think maybe it was a slip of tongue, but he's a nice examiner. He said, show me where what side is the vagus nerve? That was the question. So immediately my friend was smart enough. My friend just said, yes, it's the right vagus nerve. Instead of asking him, what is this? So immediately he gave it away that. So you have to be attentive and be smart. Some of them will just, they might give you a tip. So already he told him that is a vagus nerve. So all he just had to do is pick right or left. So he's been nice to you already. So you don't have to stress yourself and start thinking of another nerve or something. So I think the examiners were okay because immediately I finished, I was not happy at all.
Same here.
I thought it was a bad exam, to be sincere. And I used all my days, I was calculating. And the next thing I now did, I now went to Samri Malik videos. I went to videos of 2 years, 3 years ago. There's one Dr. I think Mahmoud Bazid Asif.
Yeah.
I was listening to their testimonies over and over to console myself. There was one Dr. Jangir, he said, if you have a bad station, that even if you have one bad station, I will now be happy. I will rewind that place again. I'll take it back. I'll listen again. I'll say, hi, this is a good, I like this. I'll take it back again, that what he said. So I was now using that to just to console myself. So those videos were made like 2 years ago, but it also helped us even after the exam mentally, because I was so down when I got back to my country. So when I listened to those videos, one was even like that. What he said was that you can fill a station in each skills and knowledge, and you pass the exam. So I was like, wow, okay, I think I've failed my hand exam. That was what I was thinking. I said, I think hand exam, I failed it. So if I don't fail any other one, I should skill. That's what Dr. Jangir said. I said, and he passed. Okay. I said, hopefully. So so that's how helpful those videos were. You get, so that's why I think it's good for people to share their experiences.
And maybe you didn't realize I'm recording yours as well. You joined late, so all right. You have a question. Dr. Bilal wants to ask you something.
Okay, all right, ma'am.
You and Dr. Abhishek.
Yes, ma'am. So first of all, congratulations, Dr. Abhishek, for passing the exam.
And Dr. Abdulaziz as well.
And Dr. Abdulaziz. So my question is in history, pre of confusion station. I'm confused between AMTS and MMSE. What do we actually have to perform in the exam? There's a lot of different people with different opinions about that.
Can I take that, ma'am?
Yeah, you can.
Sure.
Okay. So what I have heard, like Dr. Bilal, so the fact is, whenever you get this kind of confused patient, sometimes they actually act too much slow. Okay, so you have to ask several times to get an answer, something like that. So, but previously, or I can remember some of the doctors, like in back in 2021, they did MMSU 1 directly. But if you get confused patient, I would like to go for first, like there would be some clear-cut instruction in the STEM. You are not allowed to ask about personal information, also like past medical history. So this type of information can be there, like there's some kind of limited things you have to ask to test the patient's memory. So definitely you can go for the AMTS 1 first, and after the AMTS 1, whenever you get, you must know the interpretation. Whenever you just come to a diagnosis like AMTS like that. So, but you must have to know what is MMSC, because you can be asked about going further. Whenever you tell the examiner, sir, I would like to go for the MMSC examination now, because the MTS is less than 6, something like that. So definitely you have to be prepared for both. If you go for MMSC directly, it will not hamper your marks. But in case of very confused patient, go for MTS first. Okay, because if you try for MMSC, the 30 points, you can never finish in that kind of patient.
No, you just take your whole time.
Yeah.
Better do the one first, and then if asked, then do this one.
You can go for MTS first.
Yes. Dr. Abdulaziz, there is another question for you. Okay, they want to know your score in knowledge part.
Okay, yeah, I've not seen my breakdown. That's why.
Okay.
Edinburgh College, yeah.
I'll be able to say more when I see my breakdown, because I'm actually looking at maybe.
It doesn't matter, because pass is a pass. Even if you pass with 1 mark, doesn't matter. No one is going to go back and look at your marks. If someone passes, sorry, yes.
One funny experience about my phone call station. So I never knew that I have to go for the case file in one station, and I have to go into another station for making the phone call. Totally different 2 rooms, ma'am. So it was a bit confusing. So whenever I went to the,
I tell you, but then you forgot.
Yeah, maybe I forgotten. So the thing is, whenever I went to that station, okay, there was a chair and the table. So whenever like it was like the examiner sits in the chair, in that position the chair was there, not in like the examinee ones. So the chair was in the back side, something like that. So I just went, so there was kind of 9 minutes, so I didn't make any hurry. So I was, at last I sat there. So okay, I was going through the notes. Okay, so I thought, ma'am, like there was a telephone there, so I thought I would have to make call from that room. Okay, so after the bell rang, so okay, so I am saying that someone is entering into the room. Okay, I have to go to the next station. So whenever I went to next station, so I was a little bit confused which number I have to call, or the call will come or not, something like that.
Wasn't it written on the table? Wasn't it given to
It
you?
was written, ma'am.
Yes.
It was written, but I had some rush. So, you know, ma'am. So
well,
I was asking.
Listening, they should know once they enter the room,
that's why.
It will be written.
That's why I'm explaining. So on the right hand side, the number was written in red mark that you have to call 6144. Okay, so I just made the call. So about my phone call station, it went really good, ma'am, because I followed the SBAR. I told the examiner, so I was addressing the on-call consultant. I was telling everything. He was accepting everything what I have told. At first, I told him the situation. Then I told him, he asked about the why do you think the daughter wants her mom to get home today? So I just explained the situation, and the examiner didn't ask me about the complications and what maybe your management about the complications. So he didn't ask me. And suddenly he asked about like if the patient want to get discharged, what you would do. So I just explained the 3 points: the complications can occur, the legal form they have to sign, and the warning signs. And after that, the interesting thing happens. So after completing all the questions, I told the examiner, sir, can I please summarize what we have been through during this time? So then the consultants are actually summarized what we have been through during this time. I was never prepared for this. He was like summarizing everything what we have been discussed. So I was like, okay, sir, yes, sir. That was the thing. So then I just told, okay, sir, so I am just following the advice, sir. Do I have anything more to do? No. You can just, if the patient insists, you can discharge the patient, just follow the legal protocol. That's it. That was it, ma'am. So my main thing is, I will answer that, ma'am. I will. My main thing is here. I might have done bad, like I couldn't finish the crisp one. I couldn't press the cuff muscle. That was very important. In case of hand examination, I couldn't check the sensory part. So that was my backdraw. Someone asked like, what could be the mark? What could be the reason behind this 119 marks? I think that was my backdraw in case of getting 119 marks. But what actually made me pass, that is the 4 stations good rapport with the patient, and like their pain, their concern, how could I address them? I just maintain the norms and everything. So I think that was my basic things, like to get me at least the pass mark for the examination. Otherwise it would be hard for me. And definitely in case of skills part, the lay examiners are there, whoever is responsible for marking about the GMC1, about the skill communication part. They made a good like combination of marks for me actually. So that is the main issue here. If you just if you can't finish any examination, if you can't do well in case of any 1 or 2 station, it never matters. If you just have to focus on communicating with the patient, and you have to build a good comfort zone for the patient. Whenever you are talking to them, you have to be empathetic. You can just say sorry, but if your attitude doesn't say that you were sorry, it doesn't matter that you are sorry. Trust me. So there's like my from my side, ma'am, about the skills part.
Yes, Dr. Ulfat's question and Dr. Cynthia's question in the chat. Yes, please.
Congratulations, Dr. Abhishek and everyone else who's passed.
Dr. Abdulaziz, yes.
Dr. Abdulaziz, yes.
Thank you.
My question is, Dr. Abhishek, you were saying that during your communications station, the phone call station, you had to go to 2 different rooms, right?
Yeah.
So in the first the question station, do you get some papers or some notes that you could carry to the next station?
You will get paper and notes in every station. Whenever it is necessary, they will provide everything. In the OT listing one, in the history taking one, in the examination one, you don't need actually. So in the phone call one, you will get the case sheet in the preparation bay, and you will get the same case sheet in your phone call bay. So you can just you can also see the case file during making the call, but it will be definitely helpful if you just make a note. So you have to just leave your note in the specific station. That's the deal. So you can have it in any station, no problem.
So as in there is the question station, and then there is the phone call station. So you do not get to carry your notes from the question station to the phone call.
You are allowed. Yeah. Not the patient file.
The question and the reference values. So they will be giving the reference values also, right? Like normal.
Yes. And the fact is, Dr. Ulfat, like same case sheet in both the stations. So you don't have to take the case sheet. You don't need to. So you can only just take the paper you are making notes. So it's allowed. Yeah.
Oh, okay.
Yes.
Okay. Is that even for the counsel station with the patient? Is it the same thing?
No, because you just have to read the scenario before talking to the patient. That is then you have to just enter and talk to the patient. And about the arthroscopy one, like the patient was very much jolly whenever you were like, I just started in that way. Okay,
you counseled
I believe
him well.
Him well. So that's why like he was very much angry from the beginning. He was gaining weight and everything. So the 2 point was there, like this station is like giving all the negative information to the patient. Like I cannot give you the next date and at this moment, but I'll definitely say so whenever you are saying the positive things, say it clearly and make emphasis on that through your words. Like I'll definitely say they mention the importance of getting you listed as soon as possible to the nearest possible date. And whenever the patient is asking about making compliance, Dr. Shantu said, so the patient was actually looking to file an immediate complaint. So the pulse is there. You can just suggest it. Okay, whenever I said about the pulse, the patient got calmed down. Then I just asked him about some like must be your fasting. So I'm gonna.
When you said pals, didn't the patient go like, okay, tell me, show me where do I have to go to report and everything, or show me the form? Nothing
like that. He didn't ask for anything, but we have just said that we can just report to pulse, and there is a specific department to deal with that. You can definitely complain it there. So I just then told like emergency can come at any moment, sir. So I to be honest, like from the beginning of middle of the station, I addressed the patient as sir, something like that. I didn't think that made a bad impression. So and at the last I offered food. Whenever I offered food, he was very like feeling much more comforting and everything. So in that way, and whenever the patient is like saying it loudly, please don't interrupt, because they are well instructed. They will not kill your time, to be honest. So just let them talk. You will have also your place to talk. That is it. Yeah.
That's good. Oh, that means your communication departments went really well. That's really great. About the history taking, did you need to, like, you were taking history from the patient? Could you take down notes or something so that, later on you could...
I tried to, but Dr. Ulfa, trust me, whenever the patient is saying history, you don't need to. You can remember. So whatever the patient is saying, whatever the positive findings they're saying, you would be able to remember. So I just mentioned like to chief complaints, I was like talking to the patient and like I was moving my hand, not like removing eye contact with the patient. So eye contact is very much important in the exam. So the patient doesn't feel that you are not putting importance on the patient. So that's important, I think. Yeah. And one person actually asked in the group like about the importance station, how did I proceed? So importance station was quite new, because like on 5th, 6th, 7th importance station didn't come. So it was a new station on the 8th February. So whenever I had like this type of scenario on the stem, so I just mentally prepared myself about the chaperone things, about the confidentiality things. So whenever you have that 1 minute, you just have to make yourself prepared what you're going to ask. So in every station, there were some kind of like hand washing before entering into the room, and also in the table whenever you talk to the patient, so you can use it both in both time. So whenever there is hand wash, just use it. Okay, that would make a good impression. First of all, a good professionalism during this COVID-19 symptom season. So after that, I just approached in a normal way. So good morning, I'm Dr. Vishik here. So I'm here today. I can confirm your name. And so in every station, I confirmed this about name and date of birth, please. So they actually asked, I just added one line like, so can I address you as Mr. Jonathan? So he just, okay, doctor, just Jonathan, please, you can call me. So this is the thing, just to build a good communication with the patient first. Then I just asked the patient, okay, so today I'm going to ask a few more questions regarding the problem you are having. So he was just saying, okay, doctor, please go on. Okay. Then I told, okay, that what we have been we'll discuss here, definitely that will be confidential between you and me in the presence of a chaperone. So would that be okay? So these 2 points I mentioned, and after that I just told one word like, Mr. Jonathan, whenever this type of problem occurs, we usually ask this type of questions. Please don't get embarrassed. But if you feel any kind of shy or embarrassed, you can just tell me. I can skip that question. So after these things, I actually began. So the patient actually they don't talk much irrelevant things. This actually happened with my 2 history taking. Whatever I asked, they said yes or no, something like that. They didn't say any more words. And about the importance station, to be honest, like it was so after that, I went to like the past medical history. So after taking some past medical and surgical history, drug history, and family history, then allergic history, and after taking the personal history, then I have realized, okay, I have skipped the small S for sleep, M for mood, A for appetite, and L for libido. So then I asked about these things because I just, before I could remember that. So after that, I asked about these small things, and then I asked about like eyes, and after that I proceeded with any kind of dizzy spells, any kind of headache, any kind of chest pain, any kind of irrelevant medical findings. Then I just asked about like, is there anything more to ask? So then the patient summarized, okay, I'm super, so I was just summarizing to the patient. The patient said he has only importance with his wife, something like that. So he had no kind of stress from anywhere, but he has importance with his wife, something like that. So then I could realize, okay, so I have to make differentials according to that. So according to his history, I just made it say psychological or anxiety related importance. And after that, atherosclerotic vascular disease or any kind of drug effect, I just made this, made the orders in that way. After that, the examiner, Dr. Vishi sir was there because I knew him from the Hyderabad course actually, so I could recognize him in that station. So sir actually asked me about what is the commonest, what is the most common, like what is the provisional diagnosis about that station? I mentioned that the psychological one. Then whenever I asked, tried to start about the investigations, the time went like it was super fast. The 3 minutes gone like in 30 seconds. It seemed like that. That was the importance station went with me. That's it.
Good. Thank you.
Dr. Lithi actually asked ma'am in the group. So
yeah, that's good. Now there are certain other questions which they repeatedly ask. Now you and Dr. Abdulaziz, if you can answer, they want to know if you are allowed to take pen and paper, if you take pen and paper, if you are given pen and paper while doing examination.
No, no. You don't need, and definitely you will not use during examination.
You can't,
so
because you hardly have time.
Yeah.
Another thing, once you are doing examination, how was your attitude? Like, what did you both do? Were you explaining it to the patient, every step that you were doing, or were you doing it to the examiner?
Okay, Dr. Abdul, first answer, then I'll say mine.
Okay. For example, when I think my examination stations, the back and spine exam was the one I was most satisfied with. So I'll just talk about that. What I did was, immediately I walked in there, I washed my hands, and I saw the patient. I introduced myself to the patient. It was a middle-aged man, was already prepared. So I just told him, okay, immediately I told him, okay, stand up. So I was not looking at the examiner. So I focused on him. You just focus on him and you talk to him, because most of the examination is all about instructions. Okay, all right. Steve, so this is what I want you to do. I want you to walk towards the door. Okay, walk back. Can you walk on your heel? Can you walk on your toes? Okay, all right. Don't worry. I'll support you. You understand? So it's all about acting. Then I want you to flex your back, like I described what I wanted him to do. When he was extending, he can actually fall. So I told him, don't worry, I'm behind you, just as much as you can. So those are the things. So you tell him, okay, can you just slide your hand down towards your feet? Okay, all right, that's good. Okay, can you do this also? So he does it, because he knows all those things already. So it's just for you to tell him. So the examiner is just looking at you. So you now tell him now, okay, all right, so Steve, so what I want you to do now, I want you to lie down. Are you having any pain on your hips? Okay, no pain. Okay, all right. Thank you very much. So before I start raising his leg and I start doing, so I tell him everything I want to do. And when I was palpating the spine, because someone told me that is very important, well, I think everywhere, but very important in the UK, whenever you're going to the back of the patient, you must
tell him.
Definitely.
Yeah.
So I told him, okay, all right, Steve, so I'll be going to your back right now. Yeah, I just want to feel your bones. Okay, all right. So that's how. So it was not as if I was running a comment. So you can, it looks as if you are running a commentary, but you are talking to him and giving him instructions.
Very good.
So
yes.
At the same time, you're passing something to the examiner. You're telling him what you are doing.
Exactly.
If not, you might just be doing certain things and he'll be looking at you that, okay, what is this guy doing? What is he touching now? Okay, so I just want to touch your muscles here. All right. If you're having any pain, then you look at his face again. Whenever I'm touching anything behind, I look at his face. Okay, all right. If you're having any pain, any discomfort, Steve, you just tell me, I'm going to stop. So that is what I do. Just say, okay, if you're having any pain, please just let me know. Okay, I'm okay, doc. Go ahead. So
there's no positive finding.
Empathy, acting. So I think all those things, they look at it as if, and they are happy with you. That you're taking instruction. You're also concerned about the patient, because eventually when I was telling the patient, when I finished, I also told him, okay, Steve, do you mind if I assist you in? Oh, no. He said, no, I'm okay. I'm fine. And the summary, even for history, it doesn't come like a typical summary in which you have all the time to list everything. You just be surprised. You might just say one or two things. Yeah, I have a 40-year-old man that has impotence for like 3 years. We're having difficulty having erection for like 3 months, and he's so concerned. Everything started when he lost his job. He's so concerned, he's worried. So that is how the summary goes. And he's also hypertensive on atenolol. You just pick because the time is not that much. You don't have, and in history, you can also jot your salient points so that you don't forget. Okay, all right. Oh, atenolol. Okay, you know the dose? You write it down, your atenolol, so you don't forget. But the difficult thing, again, if you can do it before the exam, is the years. Calculating the age of the patient might be quite under tension. If someone tells you, yeah, I'm 14th September 1947, so you are confused. Is this 50? Is this 50? Oh, 47. Is this 58? Is it? So I think I'll just say, okay, middle age, because you can't get it might be difficult for you. I'll look at it. Okay, 1947. Okay, it should be in the 70s. Okay, what adds to 70? Okay, 75. You might be lucky, but sometimes you might not be that lucky. So you just say, okay, middle age.
I did that in mastectomy station. Okay, 71. Yeah.
Yes. If you look, you might not get the actual figure. And I think another important thing, so I don't forget, is that usually the communication stations, they might tell you your role, but in the phone call station, I realized they didn't mention my role. So when I got to the phone, I didn't know how to introduce myself. If I'm the SHO, if I'm this, but
there was no role.
There's an instruction. What you say is your exam number is what you use to introduce yourself. My exam number is 150. And okay, I'm working for so. Am I on to the consultant? This on call. So the man was like, what's your exam number? What's your exam number? So that place a bit, I was quite confused. But my friend now told me after the exam, he said, it's like you didn't read the instruction well. That was written there that pick up the phone, tell the consultant your exam number. That is what you are using to introduce yourself. But because we always prepare in a way that, okay, you are the SHO, you are the this, you are the that, it might not be written that way, and it could also be written. So what I'm trying to say is we should always try, in as much as we should read instructions, things can go differently and it can be quite significant. If you go with the mind of mastectomy and they are saying lumpectomy, you might get it wrong. They will say this one will misinform the consultant, so he might mark you down. But I kept reading it on and on that lumpectomy. I've never seen lumpectomy before. I've always been seeing mastectomy in the notes. So, and that is just it. So I think those things are just, they use it maybe for a catch or something, I'm not sure, or just to see if you're quite attentive
management
to details.
Differs if it's mastectomy or if it's lumpectomy. So
So one just has to look
know
at
the
all
difference.
Yes.
I certainly, ma'am, agree with Dr. Abdul. So whenever you do some procedures with any patient, so definitely the patient must know what you are doing. Okay, so if you just don't brief them, so it can lead to many more legal consequences. Just think in that way. So if you are just tapping on the patient's chest, just definitely you have to tell him, I'm going to tap on your chest by placing my finger on your chest. Let me know if you feel any kind of discomfort or any kind of pain. So definitely you will brief to the patient. Forget about the examiner. So examiner will be sitting or standing, seeing you or not seeing you, that doesn't matter. Everything that matters, how you deal with the patient.
Yes, in examinations, don't bother about the examiner. But the only time the examiner spoke to me, I told him I wanted to do shoulders. He said, don't worry.
Okay. For the shoulders test, there was no tape, there was no pain, pain. I also asked for it, but there was nothing. Ma'am.
So the thing is,
and one thing I want to mention, like in the history taking communication, there will be 3 to 4 examiners. Please don't get confused seeing to them. Don't just look to them. Just focus on the patient. They like, one is there to see the examiners, like how they are taking the exam. One is from the layman examiner who is seeing your communication with the patient. So just don't look at them. You just do your own job. Be confident. That will make you pass. Good. Definitely.
One more question. When you were practicing with me, I mostly had my own scenarios. How they were different from exam scenarios?
Not much, ma'am.
Were you able to go ahead with the exam, or?
Ma'am, I had been with you for a long time. I would like to say that I have made some extra notes. I had listened to, I had followed your instructions to the point, and that definitely the reason behind getting 148 out of 160, to be honest, ma'am. And what you have instructed, what you have told us, definitely that helped a lot, because I have already told what you are following here, that is nothing but the recalls. So it's really easy to forget, like if you just don't go through the notes few days. So if you just go through some, if you have time, if you just go through some kind of like extra questions, it will just make you confident. And definitely some questions come from there, and not all the time 100% are similar to the notes. Definitely there are like 1 or 2 questions different that you will have to answer from your residual knowledge. So that is the thing, ma'am. That's the thing.
Good.
It actually helped helped a lot,
it wasn't that much different from the real that you managed.
No, ma'am.
One more question that they ask normally, even someone has written in the chat as well. How were the normal values given? Were they easy for them to follow?
Yes. The normal values were given. Yes.
Like in millimole per liter, like that's the most common one that we follow in the best.
They give the values so you can compare to what the patient has. Then there are a lot of irrelevant information, so you just ignore them.
Yes.
They will write so many that you might not need and might just confuse you. So you just go to what you most likely need. So I think there's also a question from Dr. Nida here about
Yeah.
The thing is the good thing with the scenario they give before you examine is that they give you the diagnosis in a way. So it's unlikely for you to have a normal examination like that. Like the patient with back and spine, they already said it that when the patient is walking on the stairs, I think the patient feels better. So I already knew that this is like a spinal canal stenosis. So when the patient flexes, so in a way, when you're going there, I had some people that said they had normal findings, but when I did my femoral stretch test, the patient screamed.
Oh.
But some people did not get there, because you might not get there. You might not even get to that, because that's the last thing I did for the patient to lie prone. Yeah, but I was quite fast. So because I knew I had a disaster in the hand exam already, so I had to brace up. So when I did that, the man screamed a bit. But for someone that didn't do it, you wonder, okay, what will the person say when they ask you about your diagnosis? In this scenario, it is already being written what some of the symptoms and signs are. I think basically the symptoms. So when you look at that, you know that, okay, most likely this patient has a particular problem along spine or along the spine. So you have that in mind when you're going to examine. Because if you just have it that you have a completely normal finding, well, it's possible, but the only thing that was positive in my own was femoral stretch, and someone also said it wasn't positive in his own. But I think one thing with examination is your steps. When you do all the things you're supposed to do, I think they know that and they ask you your investigations, so they definitely know, okay, you shouldn't miss certain things if you had more time. So I think about normal findings, just read the scenario while you have a guide on what the patient might actually have. Just like the patient with hand exam, I think she's actually a cleaner. They said something about the occupation. They said something about the left hand. So you already know where you're going to. You can't go there and go and get a pathology on the right hand. You understand? They already said it in the scenario. So one should just be careful. Read the instruction carefully. You can't go there now and now say, okay, yes, it's possible you might see some findings. If you see any finding in the right, fine. But I knew already that what they were saying was most likely the left hand. So I was expecting most of the findings on the left hand. So about normal findings, abnormal findings, just read the scenario well. Don't be stereotypical. Be open and just do your best. It's possible you find something. The patient are good the actors are very good. The actor can actually do a format for you. Good, you see it. Because I couldn't do a format, and for me to say the patient had ulnar nerve would be difficult. So I had to talk about what I felt. I thought she had a TNL, sign positive, and I discussed on that. So whatever you find in your examination, just discuss it. Don't look at it that, okay, they said the patient has format. That means I failed. Well, it might not be like that. It might be that that particular time you were examining, I was even suspecting maybe they were telling the patient to actually change some things. I was suspecting that because she actually told me TNL was positive, but my other colleagues said no, that she didn't say that. So I was confused. So sometimes maybe I didn't describe TNL well to her, because those actors are very good. If you don't describe it well, they might also confuse you. So I think we should describe what we want the patient to. Okay, if you want the patient to, if it's sensation, use your cotton wool, touch somewhere first, then tell her to close her eyes. If not, she might just be telling you yes, 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 and confusing you. You understand? Because you didn't tell her what she would, so she will be confusing you and make it tough for you. Trying to tell you, you didn't tell me what I will feel or what you actually want. So I think that's how they get at people again, and one might just
they want to know if you do the examination on both hands or just the diseased hand.
Both hands.
Yes, you always have to do it on both hands.
Ma'am, about the things like I have told you, like I couldn't finish the examination. So the spinal lower limb, I didn't go up to the femoral nerve stress test. So the fact is, whenever the examiner asked me to summarize, so I was just starting in that way. So today I have examined the person, this year-old gentleman, and he came with some kind of low back pain radiating to lower, leading to thigh and back of the thigh and buttock. So on examination of this, so I just told, because I didn't have any positive finding, I just proceeded in that way. So whenever I was just telling this, so the examiner actually asked me, so according to the scenario, what would be your diagnosis? So he just asked me that. So I just told him, so according to the scenario, my diagnosis would be that. Then in case of hand examination, I told you, ma'am, like during the TNL's test, so I was instructing the patient if there is any tingling and numbness. So what is actually the TNL's test? During tapping on the carpal tunnel, there will be some tingling and numbness, tingling or pinprick sensation over the distribution of median nerve, right? But the patient told me in the distribution of the ulnar nerve. So in that case, my point was there that it can be ulnar neuropathy, and kind of like I couldn't do the sensory test. So when the examiner ma'am actually asked me to summarize my case, I was just saying the positive finding. So whenever he asked me about the provisional diagnosis, I just told like I would like to check definitely, ma'am, the sensory examination of the hand first, but I couldn't do during the time restraint. So I think it may be a case of ulnar neuropathy, because there was some kind of tingling during checking, doing the bimanual examination of the wrist, and also during the TNL's test. So things actually went in that way. So if you just start according to the scenario, it can be your summary for that patient. And in case of hand examination, definitely you will examine the both hand together. And one of my seniors actually told me, like in case of like a one ankle, right ankle examination, left ankle, or right thigh, left thigh, something like right hip joint, left hip joint examination, definitely you can follow a tricks like whenever you're briefing the patient, like the patient has right hip pain, so you will just say it loudly at the beginning of the examination. For the examination purpose, I would like to examine your normal leg first, then I will examine your diseased leg. So whenever you prompt that towards the patient, the examiner will tell you, please examine the diseased leg. So that is one thing. So definitely you have to mention first, other than this hand.
Yes, yes.
Yeah.
Another,
so mention that you will go for the normal one first, then you will examine the painful one. Yeah.
Another question, it's written in the chat. Was it written clearly in the stem? This stem belongs to pathology station or examination station. Yes,
ma'am. Same.
Reassure
like what you have written, written in your stem, like in this station, your knowledge about anatomy, knowledge about history taking, this will be tested. In this way, the stems are written.
Yes.
So you don't have to you will not get confused that which station is this. And
It
during
will
the
be
anatomy
clear.
stations,
Yes.
yeah, during the anatomy stations, the pictures were in the wall. I don't know about Dr. Abdulaziz, what he has faced. Like the pictures were in the wall, and the examiners were using the stick, and the examination was like a standing examiner and me.
Okay.
Something like that. So that was the scenario. So you don't have to sit in certain examination station. You can just stand beside the pictures and answer to the examiner. So it's quite friendly.
For anatomy, both of you had models or pictures only, or cadaver as well?
I had pictures.
And
laminated pictures. And examiners, to be honest, 95% examiners, 95% of the examiners are quite nice, because in the back of the thigh, like hamstring region, gluteal region dissection pictures, there was some kind of confusing picture, and I took time. The examiner asked me, okay, are you sure? Tell me, okay, what is this? So he actually guided me towards the proper identification. I am pretty much sure, like I got about 1920 in that station. So they are really friendly. I don't have any complaints regarding the examiners, but definitely the skills part and the communication ones, definitely we have to practice more and more to get to up to the level of the British students. Definitely that we should focus more. That's the thing, ma'am.
Yes, just go through the chat if you have not missed anyone's question.
So just like Dr.
7 a.m. Yeah, 7 a.m. Yes, you have to go, like it's always wise to go 15 minutes before. So yeah, but must be on time. Yeah.
But then
and the ambience was too good. Every step was too helpful. Like Dr. Jahangir said, they were very much helpful regarding, like everyone was there to guide you which station you have to go. So you don't have to get any kind of nervous. Just take a deep breath, and please, whenever you perform one station, just forget about that one. Just forget. Yeah.
Okay, now one
they were
question.
Also very nice too at Coventry. Very nice. The ladies, everybody. The staffs were very nice.
Very nice.
Good. Dr. Karma has one question. Yes, please.
Yes, thank you, ma'am. Congratulations, Dr. Abhishek, Dr. Abdulaziz.
Thank you so much.
Dr. Suresh or something, I think.
Santosh, yeah.
Yes. He was mentioning about the procedure skill regarding the gloves and the apron. He said the gloves got torn and he could not wear the apron. So in case the gloves tear off, can we ask for the extra gloves?
Of course.
There was a lot of like in my station, brother, like before entering the examination room. So the people there who are just helping during the changing the station, which station one after another, there are a lot of people in the outside the examination bay. So they actually instructed, please put on the gloves before entering the room. So that was the thing. There were a lot of like which I call the one-time non-sterile gloves. Full box of gloves were there.
Box, is normally there, you know, in every size, you know.
Two-colored ones.
Small, medium, and large.
Sizes. Yes, ma'am. Different sizes are there. Definitely. Yeah, ma'am.
Yes.
Yeah.
Because girls normally have smaller hand and boys mostly have larger hands, so the size difference. And even there are certain people have allergy to the normal gloves. So, and the other type of gloves are for allergic people are also provided sometimes.
Yeah.
And regarding the Dharma station,
yes.
the consultant asked that why the daughter wants to take her mother home.
Yes.
Yeah.
So like, was the scenario written in the scenario? Was it written that the daughter?
You
was
can also
living
check budget notes is written
away?
there. Yeah.
No, I mean
all the things are
in
written
the
there.
scenario.
Yes.
In the exam,
Yes.
Dr. Karma wants to know.
It was written.
Yes. And now in the chat
No, because
you have...
Dr. Santosh was confused.
Yes.
So I thought it was not written in the...
No,
It was
Dr.
written.
Santosh was not regular with us as well. That's why, he was trying to study himself, revise himself. So maybe that's why his focus was not going there. It didn't go there, definitely. Because once you are coming, and if it's 5-10 people as well, you exchange knowledge, you learn from each other. That's when, even if you have not noticed something, then you go back and you read again, and then you notice that something is there. Okay, you have to remember. And this someone writing question in the chat, if any of you can answer.
And in case we do not finish like in the history or examination,
doesn't matter.
After the 6 minutes, we can always mention that.
Yes,
yeah.
But Dr. Abhishek did, yes, because he
you can just thank the patient. You can just face to the examiner. That's it.
And like I make you practice that, okay, whatever you have missed, you should know what you have missed.
Yes,
and
Dr. Cynthia. Yeah. Sorry.
Someone else is asking question as well, Dr.
Like there was hand wash outside each cubicles, and also in the front of the examiners, also in the front of the patients. Okay, so hand washing was all over there.
And there's someone asking about the travel.
Okay, ma'am, someone also like asked me about the travel and everything. So the fact is, I'm just mentioning from my country here. I think it's pretty much similar from other countries too, if you can, if you're gonna apply visa or something like that. So definitely you have to write a cover letter mentioning why you are going to UK, why you are, how much amount you are spending, and if you are the sponsor for your travel or someone else is sponsoring for you. So if it is like your parents, your mom or dad, so definitely you don't have to show any legal documents or notarized documents for that. But if it is any kind of third person, you have to show the notarized document in the stamp paper that that person is sponsoring for you. And my advice would be definitely, like, it's allowed to apply for visa like 3 months within prior 3 months of your travel. So as much as soon as you get I got my visa this time like after 2 months 4 days, and I was really freaking out. Last year I got nothing to be rely on that and to be rely on that on them. So just definitely you just fly at least 5 days prior to your exam. So different countries have different time schedule. You have to be UK environment, but it's not that much difficult. And the thing is always follow like try to have good sleep definitely after traveling to UK, and 5 days is enough for your exam. And in the UK airport and everything, they were much more friendly. There was no problem. Like whenever they heard about like we have gone for exam, it took only 5 minutes for the immigration and everything. They're much friendly. And don't get too much bothered about this travel to UK. It's really good. Just you have to advise, you have to apply for a visa earlier. That is the what I say, like a thorn in your throat, something like that. And I had also many problems regarding the COVID test and everything, though UK government didn't need that. My country's requirement was that. So people are getting COVID without any symptoms. I was freaking out. So there was negative impact in everything. Really lucky about this with this mark. So that's it. Anything?
Yeah. So please, I would also want to use the medium to state that if there's any assistance anyone needs,
of
via
course,
Telegram or WhatsApp, I can be contacted, and I'll be glad to assist in any way.
Good, thank you.
Same here, ma'am. You know me, so yeah.
Yes, they should
We're
know
also
you.
there.
They
Yeah.
should also know you. Yes, like we have 2-3 fellows. They are always up. They always help. They even once they're fast. So I hope in the group you will also contribute and give back to others. Yes. If there is anyone else have any question, because now you have people who have recently appeared and passed in first attempt. So ask them. Any confusion that you have, anything that you need to ask.
Yeah.
It's better to get first-hand information. Yeah.
No problem. You can also save it for later purpose whenever you are free. You can ask in the group or personally. No problem. I'm here, and just pray for us, and we will definitely. I would like to request, first of all, whatever we have said. First of all, trust in yourself that you can pass.
Yes.
That people are passing, you can pass. So definitely, that's the main spirit that you will have to be your first. Don't get any kind of negative impact
to them, but you didn't believe me when I told you that
ma'am, when it comes to self, so you know,
they are
ma'am,
also going through the same situation. You know, they trust themselves.
He scared me when I sent him.
Dr. Abdul, I told you, brother, like, how was my situation? You know,
how was your exam? I said, no, not too good, brother. I said, don't worry, it will be fine. I told my friend, I said,
okay, one more question I want to ask you before we end. Many people many people before they give exam, they apply or they appear in the mock exams, especially which are arranged by the Royal College, not necessarily in UK, but like sometimes they are arranged by Royal College in the local countries as well.
Yeah.
So did both of you attended any mock exams or mock preparatory courses or anything like that?
No, ma, I couldn't, because most of those, like, you know, the exam itself, traveling is quite expensive. So I didn't have that
that luxury.
I wish I could anyway, but
I actually, ma'am, after passing party on 2019 September, so I on Hyderabad 2020, you know, ma'am, there was one day, like it was like kind of demonstration how the examinations are taken. One day, ma'am. It was 100 pound cost, so it was kind of tour. Yes, exam on that. Yes, Dr. Mina's exam center, that was Hyderabad. So I actually attended there with some of my friends. So it was quite good. Like I could see the cubicles, how the exams are conducted. It was kind of like giving you some kind of confidence that how the exams will be taken. So if it is just 100 pound and one day, so you can go for it. It's not that much, and definitely, ma'am, they give you 100 pound discount during MRCS Part B form fill up. So that 100 pound is not the thing you are paying. You are paying it. Yes, it's not a big deal, ma'am. They'll give you ultimately the discount later on whenever you book the exam from the same college. So
but
it's helpful.
Time when you appeared in that mock exam and when you appeared in the real exam was elapsed a lot. So
yeah,
how helpful that was.
That was helpful, ma'am, because the same pattern they asked, like actually during the one day thing, there was a lot of ambience. They provided lunch and everything, and they showed us the exam pattern, how the exams are taken, and also I saw like 4 to 5 people's in this exam who are in the Hyderabad. Yeah, ma'am. Nice. One consultant sir who was in one station, the actor, actress were there. So they were kind of familiar.
Nice.
So I didn't talk to them, but they were there actually. And the actor, actress were demonstrating in that course, like how they act, how they want to hear from us, something like that. So it was really helpful, ma'am, regarding getting an initial idea about the exam, ma'am, because during the exam, what things are going on. So like whenever you answer, nothing, whatever happens around you, you don't have any focus. You are just answering something like that. But if you have a little bit idea how the exams are taken, it would really help.
That's good.
It,
that's nice. Yes.
So,
yeah, but only from Royal College, ma'am. I
yes,
would recommend
only Royal College.
Yes, only Royal College.
Said Royal College. I said Royal College because
yes.
others I don't appreciate. There are many shops. Many people have opened their markets and shops, but I don't promote those.
Yeah.
Yes, Dr. Abdulaziz, you were saying something.
Yeah, I just want to say one more thing.
Yes.
It might sound a bit maybe not too common, but a lot of people ask questions about how many months do you need to prepare and all.
Yes, please tell.
In my own situation, for example,
yes,
I made the decision to go into anything MRCS by June last year.
Okay.
So June last year, I registered for September. So I did my part A September, and when the results came in October,
yes,
I told my wife, I said, okay, I want to start preparing for it. He was now like, is there no next exam? I said, no, I can't go for the next one. She said, but what you've read for the part A, is it not going to help you? Do you want to have a long time again and you start reading? I said, no, it's too close. So she pushed me a bit and I said, okay, I'll give it a try. So I now registered for the next exam, which was February.
Very good.
It is much appreciated. Yeah, wonderful.
Yeah, so what I'm trying to tell people is it's possible.
It's possible.
Tell them, yes.
It's possible.
Especially those who are appearing now in May exam and they are reluctant. They think, okay, these 2 months are not enough. Time is enough.
It's always possible, and the fact is, ma'am, the preparation time definitely differs from person to person. But whenever you are prepared, you will know from the core of your heart that you are prepared. Trust me.
Yes.
So after much practice, what you need, just practice in the skills station. Do focus more on the skills part. That will be your key to success.
True.
Yeah, ma'am.
Thank you, everyone.
Yes, thank you. Yes, this is important. And then Dr. Abdulaziz, you were working as well. You had family issues as well. So life also, while you were preparing for the exam, life also went on.
Yeah.
So that is very important to remember that life
we're very supportive.
Yes, life does not stop when you are preparing for exam. Life also goes on, and things and challenges are also there. So you have to face everything and then move on and give the exam.
Thank you very much.
That's the spirit. Yes, very good, very good. If there is any other question that I've missed, or
I don't think so, ma'am.
Because normally people are always asking these questions, even when I try to record and upload recordings so they could hear, but it's like they hardly. Yeah, that's good. Okay, so time, study material, everything we have discussed, and then it's up to them. Like if they believe on themselves, they can come here. If they want to help others and get the paid package, they can go and help others and get the paid package. And once they'll fail 1 or 2 times, then they can come to us. Remember, there are only 4 attempts for OSCE B.
Yeah.
So better do it in your first attempt and get over.
Yeah, ma'am. That matters.
True. Very good. Yes. If anyone else have any question, Dr. Rifat, Dr. Rajab, anyone, so many I'm seeing new. Like Dr. Rifat is not new, but Dr. Rajab was sent by Dr. Changi. So if anyone have any question, they can ask. No? All right then. Thank you, Dr. Abhishek and Dr.
Ma'am, after
time.
After you stop your recording, I have something to request you. So
all right, okay, I'll stop.
Sure.
Thank you so much.